Tonight, Kentucky nurses say they are now exhausted. Now, members of Congress and even the American Hospital Association are calling for an investigation into nurse staffing agencies, accusing them of price gouging at a time of high demand. WHS 1119's Tom Lally reports those high prices may only be one symptom of a larger issue.
When we think of the nursing shortage, we think of hospitals, but that excludes about half of Kentucky's nurses. The rest are in public health, clinics, schools, and the Kentucky Nurses Association says causes for this shortage could range from exhaustion to lack of influence in the workplace. That's something these staffing agencies are able to provide at a cost.
We are saving lives. And if we're afraid that we're going to hurt someone or not be able to help them, then that leaves us feeling absolutely powerless.
Samantha Hevron credits high patient loads and long hours for her decision to leave Louisville and become a traveling nurse through Kentucky, Indiana, and Ohio years before the pandemic began.
So nurses are leaving in droves, and the alternative is to work locums.
Locum tenens is Latin for placeholder, and these locum or travel nurses have filled crucial needs during this pandemic. But as time goes on, prices go up. The American Hospital Association, Healthcare Association, and Center for Assisted Living sent this letter to the White House coronavirus team, claiming nurse staffing agencies are exploiting the shortage, charging 2 to 3 times pre-pandemic rates, and keeping large portions of the profit.
If there were not travel nurses or agency nurses, we wouldn't have enough nurses to take care of the patients.
That's why Delano Mason, head of the Kentucky Nurses Association, says these increasing prices are only a symptom of the larger problem.
There was a nursing shortage long before the pandemic hit, but the pandemic has really ripped off the bandage.
A survey they released late last year found 25% of Kentucky nurses were likely to leave their job in the next 3 months. 26% cited physical exhaustion as a reason for the shortage.
I might as well make a lot of money and not be treated well as to stay home and not be treated well.
Mason says that larger issue can be solved by hiring additional support staff, bringing back retired nurses, and treating existing nurses with more respect.
We're just looking back and saying, what are we doing this for? We're being taken advantage of.
Until then, this nurse will continue to travel the Ohio Valley. In Louisville, Tom Lally, WHAS 11 on your side.